Good morning. My name's Rachel Shelby. I'm a family nurse practitioner here at Core Medical Clinic in Monroe, Louisiana. I am the healthcare provider here. I want to briefly talk to you about the importance of breast cancer and screenings with mammograms, especially for women. So, about 30% of newly diagnosed cancers each year in women are of breast cancer. So, that's the important measure to think about is that I need to screen for breast cancer annually. We do that over the age of 40 by having a mammogram each year. I recently had a patient who had a bad experience with a mammogram, and I understand sometimes they do hurt. They press and they squeeze, and it does cause pain. She had to go back several times because there was something there that they couldn't figure out what it was, and it ended up being nothing. Well, let's fast forward for about 10 years. She hadn't had another mammogram in 10 years, and she thought, I'm not going through that again. It was horrible. Well, when she came to me, I really stressed the importance of having a mammogram. Technology has changed. They have improved imaging and made it so much easier. Yes, it may still hurt a little bit, but the importance of having it done annually is cannot be stressed enough, and especially by this case. She ended up going to have her mammogram. Well, unfortunately, there was two tumors in her breast that they needed to look at further. It took a lot of convincing for her to go back and have an ultrasound and then eventually a needle biopsy. But once the biopsy was completed, it's unfortunate to hear, but it was breast cancer and it was invasive breast cancer. But she has gone to the surgeon, she has had it removed, and her prognosis is very good for a full recovery. So the importance of this is to get your mammograms, get your preventative screenings, have your wellness, so that way we can treat appropriately and be ahead of the game, and not to become too late where you're at a stage 4 or 5 cancer and you have to undergo some extensive treatments. And unfortunately, it doesn't that does happen every now and then. But there's a reason why we have these screenings in place. And I hope everybody can come get a wellness and do their appropriate screenings, whether you're a male or female, so that we can make sure that you're in good health. Have a great day.